Merhaba arkadaşlar. Bu videoda Tuğba ile bir iş mülakatı simülasyonu yapacağız. Bir interview, görüşme nasıl yapılır onu göstereceğiz. Soru ve cevaplar halinde ve şimdi burada dikkat etmeniz gereken bir noktayı söyleyeyim. Hastaneler genelde interview'larda karakterinizle odaklanır. Ajanslar daha çok teknik bilginizle ve tecrübelerinizle ilgilenirler. O nedenle birazdan soracağımız sorular sizin problem çözme beceriniz ve karakterinize yönelik olacak. Hazırsanız başlayalım. Hello Tuğba. Welcome to our hospital and interview. How are you doing? Can you introduce yourself briefly, please?
Thank you. I'm fine. Actually, I'm a bit nervous because I speak English as my second language. Also, I'm so excited about this position. Thank you for having me. I'm a dedicated and compassionate registered nurse with 5 years of experience in providing high-quality patient care in fast-paced hospital settings. I specialize in medical surgical unit and I'm known for my strong clinical judgment and calm demeanor under pressure. I'm passionate about patient advocacy and continuous learning.
Why did you choose nursing as a career?
I chose nursing because I've always wanted to make a difference in people's lives during their most vulnerable moments. Nursing allows me to combine science, empathy, and problem solving all in one profession.
How do you handle a patient who refuses treatment?
First, I make sure the patient fully understands the treatment, including benefits and risks. I listen to their concerns without judgment and involve other team members like doctors or social workers if needed. Ultimately, I respect the patient's autonomy and document everything appropriately.
What would you do if you made a medication error?
Patient safety is my top priority. I would immediately report the error to the charge nurse or physician, monitor the patient for any adverse reactions, and complete an incident report. I also reflect on what led to the error and how can I prevent it in the future.
How do you deal with a difficult patient or family member?
I remain calm and actively listen to their concerns and show empathy. Often frustration comes from fear or lack of understanding. I provide clear explanations and involve the care team when necessary. My goal is to de-escalate and build trust.
How do you prioritize your tasks during a busy shift?
I start with a quick assessment of each patient and identify the most critical needs and delegate appropriately. I use tools like SBAR and checklists to stay organized and communicate efficiently with the team. Flexibility is key when new challenges arise.
How do you stay up to date with nursing best practice?
I regularly attend continuing education courses, subscribe to professional journals, and participate in workshops or online platforms like Simple Nursing. I also learn from peer collaboration and hospital in-service training.
Describe the hardest decision you had to make recently.
Recently, I had a patient whose condition deteriorated rapidly, and I had to decide whether to escalate care immediately or wait for the attending physician's schedule check. I trusted my clinical judgment, notified the rapid response team, and initiate interventions. It turned out that the patient was having a silent MI. Acting early made a difference in his recovery. It was hard, but I learned the value of confidence in critical thinking.
What are your future career goals and how will this position help you achieve them?
I hope to gain deeper expertise in critical care and pursue a specialty certification and mentor new nurses. I'm also open to leadership roles where I can contribute to quality improvement.
Describe what you think great patient care means.
Great patient care is a balance of clinical excellence, empathy, and advocacy. It means treating the whole person, not just their symptoms. It includes clear communication, respecting their dignity and preferences, and ensuring their safety at all times. When patients feel heard, informed, and cared for holistically, that's when we're providing truly great care.
Describe a mistake that you made on the job or in clinicals and how you handle it.
During clinicals, I once almost administered medication without double checking the MAR properly. I caught the mistake before administration and reported to my preceptor. and completed a safety review. Since then, I've developed a routine of triple checking the 5 rights of medication and using a mental pause before every administration. I took it as a learning opportunity.
Describe a time when a coworker or nurse manager made you upset.
A coworker once criticized my charting in front of other team members during a shift. I felt disrespected, but I waited until the shift was over and approached them privately. I shared how I felt and asked for feedback in a constructive way. We cleared the air and later they apologized. It reminded me that professionalism includes how we handle interpersonal tension.
What has been the most valuable criticism a manager or charge nurse has given you?
Early in my career, a charge nurse told me that I tend to take on too many tasks myself rather than delegating. She helped me that safe patient care is a team effort. Since then, I improved how I prioritize and collaborate, which has made me more efficient and less overwhelmed.
What is the most important quality a nurse can have?
I believe the most important quality is adaptability. Healthcare is unpredictable. A great nurse needs to stay calm, think critically under pressure, and adjust quickly to changing patient needs or emergencies, all while maintaining compassion and professionalism.
How would you handle a rude physician or supervisor?
I would remain professional and focus on the patient's needs first. If the behavior affects patient care or my ability to do my job, I would address it privately and respectfully. If needed, I would involve the appropriate supervisor. My goal would be to de-escalate and preserve a respectful working environment.
Why are you a candidate for this job?
I bring strong clinical knowledge, a calm presence under pressure, and a genuine passion for patient advocacy. I adapt quickly, communicate effectively, and thrive in team environment. I'm also committed to lifelong learning and improvement. I believe I can contribute both to excellent patient outcomes and to a positive team culture.
What type of situation at work has caused you stress? What did you do to overcome the stress?
I recognize that self-care is essential. I debrief after tough cases, lean on supportive colleagues, and engage in activities outside work like exercise and journaling. Staying grounded helps me remain present for my patients. A team I can lean on for questions, ongoing education, and full professional support.
What are your expectations of us? That covers my questions. Thank you so much.
Thank you for having me. Evet arkadaşlar, şimdi bir simülasyon örneğini görmüş oldunuz. Bu hastanelerle yapacağınız iş mülakatlarındaki soruları içeriyordu. Burada profesyonel olmak, kendinden emin olmak çok önemli. Heyecanınızı göstermekte bir problem yok. Ancak her zaman kameranın karşısına bakımlı bir şekilde kıyafetleriniz, arka planınıza dikkat edecek şekilde çıkmanız çok önemli. Bu interview'lar biraz daha sizin kimliğinizle, karakterinizle ilgilidir. Dolayısıyla sadece söyledikleriniz değil, beden diliniz, ses tonunuz, iletişimin diğer bütün unsurları çok kıymetli olacaktır. Sizlere şimdiden başarılar diliyorum. Heyecanlanmakta bir problem yok. Bizler burada durmaksızın belki yanıtlamış olduk. Fakat sizler duraksayabilirsiniz, takılabilirsiniz. Unutmayın ki hastane yönetimi yeni adayların heyecanlarına çok alışkınlardır. Burada önemli olan kendini rahat bir şekilde ifade etmek. Duraksasanız da problem yok. Devam edebilirsiniz. Başarılar diliyorum.